by nature, and I'm in that kind of mood, Let me do some praise. One of my favorite feel-good songs is Only One by Tenor featuring BB Winans. I'll do that and come back to the business of today. I still got the eye specialist in the studio. Today I'll ask them, they say beauty lies in the eyes of the beholder. Is that a disease? Stick and stay.
Still, you choose to play the part. If you let me be, I'll be all you need, all you need. I wanna be the only one to hold you, touch you from the right. I wanna be the only one to soothe you, raise all the fire. I wanna be the only one to love you, love it over again. I wanna be the only one, the only one, the only one I am. Now you deserve a mention. My Lord, you do. You can have the best of life. With all this, I'll give you
Joy 99.7 FM.
can't buy. If you take a chance, I'll be worth the chance, worth the chance. Oh, I wanna be the only one to hold you, touch you from the right.
Joy 99.7 FM.
Raise all the fire. I wanna be the only one to love you, love it over again. I wanna be the only one, the only one. If you let me be, I'll be all you need. If you take a chance, I'll be worth the chance. Oh my, if you just love me, you will gladly
Joy
see
99.7 FM.
all you need.
That's right, if you just love me, you gladly see. So just let him be the only one. Ultimate Health on Joy 99.7 FM. Oh, I just love this to bits, huh? But back to business. You know how we do it on a Sunday afternoon. We have fun, but we still get it done. Last week, we celebrated with the eye specialists World Sight Day. Love your eyes. So I've got them back in the studio, Dr. Jifa Oforeje, Dr. Vero Beyo, and Dr. Sewa Aqua. Is it Vera? Sorry, Vera. It's not my eyes. This one is my brain. But they're back in the studio, and today we're going to delve into some conditions. You're welcome to join us by WhatsApp 055 11 11 997. We're live on Facebook and YouTube talking eye business with my eye doctors. So, ladies, you're welcome.
Thank you, Nortey.
Right, I'm in the spirit there. It's like that on Sundays, but it's great to have you back and to extend our Ultimate Health World Sight Day. We did some general stuff, how to look after your eyes. We had loads and loads of questions, and my listeners said, bring them back. So you're back. You're welcome. I started with a bit of a joke or a pun.
Yeah.
Beauty lies in the eyes of the beholder. Right? You guys don't deal with that.
We do a little bit.
A little bit. Oh, so I knew you saved me.
bit,
Right. So, if you don't see, you don't appreciate somebody's beauty, do you see a surgeon, an ophthalmologist? What do you see?
You see your psychiatrist.
Psychiatrist for
Yes,
not.
for not appreciating somebody else's beauty. But the important thing is that everybody has to appreciate their own beauty.
Okay.
Okay, and The face is one of the first things people come across when you meet somebody.
See the way I'm looking at your
And-
face.
And unfortunately, sometimes we have to remove people's eyes, okay?
Okay.
And it can be a bit disconcerting when you're looking at somebody and there's no eye. One of their eyes are actually missing and there's an empty socket, or there's a defect, or one of the eyes is looking somewhere else. One is
Okay.
looking straight and the other one is looking somewhere
Right.
else. Those things are
See me, see
problems,
Gambaga. Right.
or that sort of thing.
Yeah.
And these are problems that ophthalmologists are actually able to solve.
Okay.
So Jifa and Vera are specialists in straightening eyes.
Okay.
Yes.
All right.
And then what we can
Eye
do,
alignment. Okay.
Precisely.
All right.
and the other people who have actually lost their eye through either accidents or the fact that they've had tumors, we've had to remove the eye, or they've injured the eye, we have to remove the eye. We can make them look a little bit more normal.
Right.
And we have a center in Kolebu that actually makes artificial eyes to fit.
Wow.
So,
You know, if
yeah.
you'd make a great politician, because the way I threw the question out there, right, beautilizing the eye, you see the way she's gone around it. Wow, I can imagine you reading the budget. But many thanks. You're just listening to Dr. Sewa Aqua. She's a consultant orbit and oculoplastic surgeon, and she says if you are not able to appreciate someone's beauty, have yourself checked out. But let's get back to the business, right? How's it been? So, I mean, you've been raising awareness as part of World Sight Day. You've done some screenings. You mentioned wonderful stuff that was done in Cape Coast. What's been the response before we get to today's business? What's it been like, Jifa?
So the response has been very good. We've had lots of people coming over to find out about their eyes, wanting to examine their eyes. We've
Okay.
had corporate bodies wanting to organize eye screening
Wow.
for their staff.
Okay.
So we hope to keep this momentum. And if we are all able to put aside a week in the year just to check our eyes,
Check your eyes out.
then it will go a long way to help us.
Okay, right. There are beautiful people out there you probably haven't seen. Check your eyes. Get yourself examined. So today we want to get a bit more, detailed, some of the stuff you deal with, and you've each chosen a zone you want us to, look at. So one of the long ones was allergic conjunctivitis. Was it that?
Yes.
And that's for Vera.
That's for Sewa.
Sewa rather. Oh, really? So, eye allergies and stuff I can understand, but the big Scrabble word conjunctivitis. So what's
If
that?
you want to get 149 points in Scrabble,
Triple word score.
precisely two
Wow.
triple word
Two
scores,
triple-
you get it.
Charlie, we have to play. All right. So let's explain for my listeners. Allergic conjunctivitis. What's that?
So you actually hit the nail right on the head.
Right.
It is basically eye allergies.
Right.
okay? And this is one of the most common, most prevalent conditions that we come across in the clinic.
Okay.
Easily about 30 to 40% of our patients are probably coming with some form of allergy. or
Across
the
board.
other. Across
Adults,
board.
children.
Across board.
30%.
Yes.
Okay.
And sometimes this is even in addition to other problems that they may have in their eye. And this is mainly because of the environment we live in. Sometimes there's a lot of dust in the air. Sometimes we have all year summer, so there's a lot of pollen and stuff in the air
Okay.
that people react to.
Right.
And the eyes are open, so there's direct contact with the eye, and the eye reacts to these things. So what people mostly have would be itchy. They'll mostly complain of itchy eyes.
Itchy eyes. Okay.
Yeah. But some people will just have pain. Some people will just have a gritty sensation. Some people will just feel some dryness on the eyes.
Okay.
And for people who have asthma, asthma, who have allergy to skin, they are more likely to have these eye allergies also.
Right. So your eye is reacting to something.
It's reacting to something.
Right. And that reaction could be unique to you. Therefore, it qualifies to be what? An allergy. Right? Or
Unique to you in the sense that you are the one reacting
Okay.
to it. So yes, but
Yeah.
other people
Other
are also
people-
having similar conditions.
Okay.
Okay. And that causes allergy. Most people have a mild form.
okay.
That drops and frequent washing of face, cleaning louver blades, reducing the amount of particles in the air
Particles.
that you can get into contact with,
Okay.
may help to improve their symptoms.
All right.
Unfortunately, there are about 5% of people who have it more severely, and these people would actually need intensive treatment all the time,
Okay.
which includes, of course, regular follow-ups, may include some injections to just reduce the amount of reaction
Right.
that the eye is having.
Okay. So typically, I mean, if my eye is itching or whatever, I'll rub it. Right.
Yeah.
Are there any things we shouldn't do in response to? I mean, when we are within the normal or the mild ranges, right? You say some will have it a bit more severe than others, and therefore they need attention. But typically, people rub their eyes, they pick at the sides of their eye, they do all sorts of things. What should we not be doing, and what could I say worsens the case? So my eye's itching, or it's a bit sore, or I feel it's gritty. What should I be doing?
So I want to say a big what you shouldn't do
Okay.
is to walk into a pharmacy and get any eye drop. Okay?
You shouldn't.
You should not
Should
do
not.
that. Not to do that.
Right. Couldn't, didn't, wouldn't, shouldn't,
Should not.
mustn't. Okay.
Should not.
Should not. All right, all right, all right.
And all apology to our pharmaceutical staff, but sometimes
They themselves, they shouldn't.
yes, they shouldn't be doing it.
Right.
That's why I'm saying that all apologies to them.
Okay.
But people walk into the pharmacy with
Mm-hmm.
any kind of symptom, and sometimes they are given drops. Sometimes this drop may contain steroids.
Okay.
And depending on what the eye problem is, you can easily move from mild irritation to blindness just by using medicine that was given over the counter.
Okay.
Okay. What you should do is get your eye checked. And we went over the 4 O's of
Right.
eye care,
Right.
either an ophthalmologist if you have one available to you, an ophthalmic nurse, or an optometrist.
Okay.
And we are all trained to identify if it's just an allergy,
Okay.
and if it's more than that, to refer onward. So you
Okay.
see an optometrist or an ophthalmic nurse. If they can help you, they would help you. If they can't, they refer onwards to an ophthalmologist
All right.
to diagnose and treat correctly,
Okay.
appropriately.
All right. So this has to be properly handled by professionals with the requisite qualification and training, right? You don't just
Precisely.
pop into a chemical shop, a pharmacy, and grab eye drops or whatever. Sometimes even ointment and other things.
Ointment,
And
yeah.
people find it very convenient. But in this case, we know, as in most cases, convenience may be a curse, and you may be messing up with your eyes. So loving your eyes is, staying away from some of these things. I've got this from last week, and it says, Nortey, please, my question on the effect of using a phone in the dark was not answered. My vision is getting blurred, and the eyes are shrinking. Nah, so are you still in the dark? Me, I like hitting it straight, though. She wants to hear it here. So can we quickly hit that? She uses her phone in the dark, phones, laptops. People are doing this. People are watching movies on their phones and their laptops. And this question is, well, am I doing something wrong?
Okay. So using the phone in the dark in itself will not make you blind, will not give you any eye pain or cause your eye to shrink.
Okay.
It's just uncomfortable to do that. And when you strain your eyes in the dark, it can give you what we call astinopia, can give you pain in the eye, but it should not shrink her eyes, or it should not make her eyes worse. So so long as you can read, the amount of light is available for you to read and you're comfortable with it.
Okay.
It shouldn't harm your eyes
All
in
right.
itself.
But her
yes.
vision is getting blurred, and her
So that-
eye, she says, is shrinking.
Exactly. So it may not
may not
not
be
have
that.
anything to do with the darkness. We
Okay.
spoke about glaucoma, not giving you any signs. All
Okay.
you see will be your vision deteriorating.
Okay.
So she can have refractive error. There are 1,001 things that could be accounting for her.
Okay.
The loss in her vision or her
Right.
poor vision.
Okay.
So she needs to see an ophthalmologist.
All right, great,
Yes.
great. If you've just joined us, this is Ultimate Health on Joy 99.7 FM with me, Nortey by nature. I'm with the eye specialist, right? Lovely ladies in the studio. We're live on Facebook and YouTube. We're extending our coverage on Ultimate Health of World Sight Day, and we're focusing on specific things. You just heard some good stuff about allergic conjunctivitis, right? All those funny things that happen to your eye. and the things you shouldn't do. Don't just pop into a pharmacy, pick up something, and be messing around. It has to be examined and diagnosed properly, and then the right and proper remedy will be, should I say, administered. Okay, right. Ajiman Joseph again. I got to look for this guy. Good afternoon, Nortey, and thank God for bringing your guest back. Please ask what piles have to do with the eye. Oh, Ajingo Joseph. All right, I'll pile that on the other side. I will pile that, and don't bring it when I open the phone lines. I'll pile that and do that later. So anything else on conjunctivitis? If it's a kid, they're likely to be picking at their eye, rubbing, and so on. So is there any special consideration if it's a child? Just quickly before. Yeah.
Well, the reassurance is that most children will grow out of it.
Okay.
So that's a lot of parents are distressed by it, but it does get better.
Okay.
For the picking, the best way to stop them from doing it is to actually give them the right medications for
Okay.
it. We have anti-allergic medications, and once they're able to use it, they get relief, and then they don't pick.
Okay.
Because if there's excessive rubbing, and they are sleeping and they are kneading into their eye. I've seen it before, and it's really disturbing.
Right.
That might affect their vision later on.
All right. Right. Interestingly, I'm not getting questions on false eyelashes and other things you poke yourself with them, but I guess I'll hear they're safe since I have ladies in the studio. Hello, Nortey. My mom is 84 years, suffering from cataract. She cannot see. The doctor says surgery is the only solution, which I am not comfortable with. Please, is it advisable to do the surgery? Can we get medication for her? Denise, quick one on this and then we come back on track. Cataract, 84 years old. Doctor recommends surgical intervention. She's not comfortable with that. It's not her eye. But she's looking for medication.
So I think this listener is probably worried because of her mother's age.
Okay.
She's 84. But she should be reassured. The surgery is very safe, and the anesthesia is usually done under local anesthesia. So a small injection is given just beneath the eye. It's a day procedure. It's done
All right.
mostly within an hour. It's over,
Okay.
and then the mom goes home the
All right.
same day. Unfortunately, cataracts, matured cataract, can only be managed surgically.
Okay.
You see some adverts on social media all over the place about drops that can cure cataracts.
All right.
Unfortunately, they're not proven. So for now, surgery is the mainstay of management for cataract causing blindness.
Okay. So her mom will walk in, walk out.
Walk in, walk out.
And from the doctor's recommendation, your assurance as
Yes.
well, is
It's a
likely
safe-
she'll get her sight back.
Exactly.
Right. Okay. Great. Good day, Nortey. You didn't answer my question last week. This is the guy in Germany. You
We
did.
did.
Yeah.
Yeah, we did.
Jifa.
Yeah.
Just quickly.
Sewa answered it. Whether
Yeah.
pterygium causes blindness?
Yes.
Yes. So pterygium in itself will not cause blindness, but if it grows bigger and occludes the part of the central part of the eye that you used to see,
Okay.
then it can cause blindness.
Okay.
But once it's taken off, then your vision is back.
All right. Okay. I guess I'll do the honors and say, can we just quickly explain to listeners what that is?
So pterygium is a growth,
Okay.
a fleshy growth that usually starts from the nasal part of your eye,
Okay.
the white part, and it moves onto the clear part of your eye.
Okay.
And we all see through the center bit of the clear part of our eye, which is called the cornea. We see
Okay.
through the pupil.
Right.
So if this fleshy growth goes across the cornea to cover the pupil, then you will not be able to see.
Okay.
Yes.
Right. Okay. And
So
you're
it's an
talking about
avoidable or treatable blindness.
right. And you're
Okay.
talking about the removal of that growth.
the removal of that
Okay,
growth.
great.
Yes.
We're learning. You see, big words or big brofo. And like Sewa and I said, Scrabble. You people, you don't play Scrabble. Short forms and social media. What first aid do we give to pupils with itchy or inflamed eyes? Now, pupils as in students or little kids in school or the the pupil itself. But Papa, see, I think Sewa has mentioned what you should do and what you shouldn't do. And I think teachers should be mindful of some of these things. Sometimes they also, I don't know whether it's first aid or whatever, little things they do that may complicate matters. Great. Okay, so we're cool with allergic conjunctivitis. If you have any questions, concerns, experiences, my WhatsApp is 055 11 11 997, right? The eye specialist, the eye SWAT team. I like bringing in SWAT teams there. I bring them in threesomes. And so far I've been doing female threesomes. It's working. Right. Okay. So the other one was it retinoblastic cancer? right?
So
Did I get it right?
It's retinoblastoma.
Blastoma. All right.
Yes, so
Okay.
yes. So retinoblastoma is a cancer that occurs in children.
Okay.
It affects the part of the eye called the retina.
Okay.
So the eye, we can broadly group it into three different parts. The front part of the eye, which is the clear part that we spoke about last week, that must be gene clear. That is the cornea. Then the middle part of the eye, which is the lens, okay, which develops cataracts as you grow old.
Okay.
And then the back of the eye, which is called the retina.
Okay.
Okay. So these retina cells in the children, usually children less than 5 years old, can undergo malignant change
Okay.
and cause cancer of the eye. Now, this retinoblastoma, and globally, you see about 8,000 cases in a year. And in Ghana, we're seeing about 70 to 80 cases
8,000 across the whole world.
across the whole world. And in
Okay.
Ghana, we're seeing about 70 to 80 cases a year.
Okay.
Kolebu is seeing close to 30 to 40 of those cases.
All right.
Okay. And it usually will present less than most of the patients will present less than 3 years of age.
Okay.
And then the majority of them will be about 18 months.
Okay.
Okay. So the thing about retinoblastoma is the reason why we worry about it is that if it is left untreated, the child will certainly die.
99.7
That is one thing that we are sure of. If the child has retinoblastoma and nothing is done about it, that child will die.
Okay.
And the survival rate of retinoblastoma in the Western world is about 95 to 98%. And in Ghana, it's less than 50%. And it's less than 50% because of the late presentation.
Okay.
So patients will present late with the disease. And even after they've presented late, they will present late with treatments too. So even after you've been diagnosed,
Right.
getting funds to treat or deciding that you want treatment is another reason. And then the sheer nature of the tumor.
Okay.
Gladly or fortunately, the tumor presents as a white spot. Okay, so you notice a white spot in your child's eye. It doesn't present in a very malignant form. It starts slowly, so you would notice a
This
white
is something
pupil.
you can see.
Yes, so the
yourself.
parents will just notice a white pupil in the child's eye.
Right.
They will say that it sort of glows in the dark. Maybe at night the child's eye looks like a cat's eye.
Okay.
Okay, and usually it will be, most of the time when it starts, it will be in one eye. So the child will be able to see with the other eye. It doesn't cause pain.
So
in the early
when
stages.
you have the white spot
Yes.
visible,
Yes.
does that mean the child has lost sight in that eye, or that's the
So it
the
depends
initial
on,
stage?
it's the initial stage is what
Okay.
I'm saying. So it's in the initial stage is the white spot. Okay.
Okay.
And half of the time the children will have vision in the other eye.
Okay.
And it's not painful. So they will go about their duties. They are able to pick up things. They have vision. They don't bump into objects or anything.
Right.
And because it's not painful, parents don't tend to seek help.
Okay.
A few of them to them may seek help, like Sewa said, may go to the wrong places and they'll be told that the child may grow out of it. So they forget about it until the child starts bumping into things, by which time it probably has affected the second eye.
Okay.
And the child is unable to see.
Right.
So the first sign, majority of the patients, about 60%, will present with that white spot in the eye.
Okay.
Then another 20% will present with the eye misalignment, what we call the aluk me, aluk London.
Okay.
Okay, so it's not every aluk me or any squint, every squint in the eye that is benign.
Okay.
There can be another lesion that is
Or a
causing
growth
you
which is
a
malignant.
growth, malignant
or
that is
cancerous.
causing it. So
Okay.
we know that majority of the people who have squint in their eye may be corrected by glasses or by surgery, but
Okay.
there are a few number of people that it will be due to retinoblastoma.
Okay.
So the child will present with a misalignment, and like that misalignment is not painful.
Okay.
The child can see with the other eye, so there's late presentation. Majority, about 80% of the patients that we see in Ghana present at the late stage of the disease, when the disease has affected the part of the eye that sees. And unfortunately, because the eye is closely related to the brain, when the tumor is going out of the eye, it enters the brain. Okay, so most people are presenting when the tumor has become big and then the eyeball is swollen. I'm sure we've all seen pictures of children with huge growth on their eyes on
Right.
social media.
Right.
soliciting for funds. That is the advanced stage of the disease.
Okay.
And unfortunately, once it goes into the brain, then we've lost the battle.
Okay.
However, in the early stages, there are lots of treatments that are currently available that can be administered, that can not only make the child survive, but in some cases restore vision in the sight of the child. So say the tumor is not at the part of the eye that the child needs to use to see, which we call the macula or even the optic disc. If the tumor is not there and the patient presents early, we are able to treat the cancer for the child to have a normal life.
Okay.
Unfortunately, in Ghana, close to 80% of the patients who present to us present with late disease. So we have no option than to take out the eye.
All right.
And that is where the delay in treatments comes
Okay.
in. So the diagnosis is made, and no mother wants to take out the child's eye. So you break this news to them, then there's the delay. So most people will go roam around, go to churches, go everywhere else but the hospital until it's become very advanced. In that case, we need to take out the eye. We need to give chemotherapy to shrink the tumor, and then after that, take out the eye.
All right.
And like Sewa said, we have an ocularist in the hospital currently. So once we take out the eye, we are able to fit the child with a prosthetic eye, which will not see, but help the child live a normal life, be able to go to school. We know how children can be very mean. So when the children go to school without the prosthetic eye, they are made fun of and they are not happy. But once we are able to fit the prosthetic eye, the child can have an almost normal life. So what we are saying is that retinoblastoma is not a death sentence.
Okay.
80% of the patients who come late. That makes it look like that. But once it is detected early and treatment is given, okay, the child can live a normal life.
Okay. But treatment is expensive. Right.
Treatment is expensive, but without treatment, the child will lose their life.
Okay.
So when you look at the cost of treatment vis-a-vis the survival of the child, it doesn't become that expensive anymore.
Right, you're on Joy 99.7 FM Ultimate Health, your ultimate guide to healthy living. 14:33 already. Oh, it's my eyes. Okay, it's 33. Right, time flies when you're learning and growing. But this part has worried me a bit. Okay, white spot means it's on its way. It's been there. It affects the back of the eye, the anterior of the eye.
The posterior.
Posterior,
the
sorry.
retina.
Sorry, posterior, right? And so what else will we see if the spot hasn't shown up or manifest yet? What else should parents look out for? Should just be testing your child's eye?
So-
I'm going to add to this because from the statistics you give me, the incidence, it's pretty rare, right? You're seeing about 70 a year. Across the world, we're seeing, 8,000? Okay.
Yes.
So is there anything, any predisposing factor, anything that you can add very quickly to the information that would encourage parents to check and look out for these things?
So that is why we spoke. Remember last week we said that when every child is born, before your first birthday, ideally
Okay.
at birth, we should have a quick screening tool.
Okay.
There's an examination that the eye health practitioner will do. It's less than 10 seconds. You just shine light into the child's eye and you check to see whether the lights coming back to you is
Okay.
red or not. We call
Right.
it the red reflex test.
Okay.
Okay, so just by doing that test, okay, we'll be able to tell you that it's abnormal or it is normal. So if you have your child is born and the eyes are checked, if your child's eyes are checked by the time they are 1 year of age, okay, these things may be noticed at that point.
Okay.
And if you notice anything that is unsettling with your child, you have other children, you didn't notice those signs in the child's eye, and you notice it's in your child's eye. The best thing to do is to go to the ophthalmologist
All right.
and ask about it. Ask for your child's eyes to be screened.
Oh.
So you can see the white spot, you can see the eye deviated, or you can see this persistently red eye that you keep treating that doesn't get better.
Okay.
So all these are red flags that should let you want to see an ophthalmologist.
All right. Kind of like almost bringing tears to my eyes, because I'm wondering, having a child with a cancer, which is advanced or presenting late, and hearing all these details, and then you're hit and confronted with the cost of that life-saving intervention. It's serious stuff. Anyway, if you just joined us, 36 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. And we are learning more and more about eye conditions. There's another one coming up. Abik was just drawn my attention there. Messages on Facebook. Somebody's actually asking about a pain he gets every time he wakes up. Please, we try to educate and empower. Where your question is not specifically what we're discussing, and also where it's not specific, it's difficult to relate to the question. So I'll ask, I think it's Don something, right? Don Mark. Yeah, tell him to, Don Mark, please give us more information, even though we might not address it on the program. Later on, I can follow up and get you some attention. Right, this one says, Nortey, please, my senior brother went to hospital with a sight problem, as if there is smoke. Okay, he was told the nerves are weak. What is the remedy? Anyone want to comment on this? Smoky eyes or?
Yeah.
Yeah.
So some patients will complain that their vision is blurred and it looks like there's smoke in the background when they're looking at images.
Okay.
And from his question, he was told that the nerves are weak. And last week we talked about the optic nerve, which
Right.
is the nerve that connects the eyeball to the brain and interprets the images that we see.
Okay.
This could be glaucoma, probably an advanced form of glaucoma, or it could be any of the optic neuropathies or diseases that affect the optic nerve. So in
Okay.
hypertensive, diabetics, people with chronic diseases, some inflammatory conditions can damage this optic nerve.
Okay.
Unfortunately, nerve problems are difficult to treat and mostly irreversible. The damage is mostly irreversible. So we try to maintain the vision that the patient presents with at the time they are coming, or to give them low vision aids. These are high-powered spectacles, kind of, or aids, optical devices that can help patients who have these kind of irreversible conditions see better.
Okay.
So that's what we can do.
All
for
right.
such people.
Okay. This one says, hi, Nortey, I have glaucoma. Anytime the sun shines heavily, tears flow from my eyes. Please, what's the next solution? Oosh. Okay.
So in glaucoma, sometimes the pressure within the eye is high, and when that happens, what Dr. Fourier J mentioned earlier, the cornea or the
Okay.
transparent portion of the eye that is in front of the eye becomes swollen because of the high pressure. Now, when this cornea is swollen, when you look at the sun, you have what we call photophobia or pain when you look at bright sunlight.
Right.
And this can cause tearing because the cornea gets irritated, and so you have tearing. What is the solution? You need to control the intraocular pressures.
Okay.
So wherever he's receiving care from, he should go back, make sure that his pressures are under control. Because if the pressures are not under control, this
Okay.
problem will keep.
And this is somebody who already knows he has
He has
glaucoma.
glaucoma.
So he should go back.
He should go back.
Right,
And if
okay.
he's not satisfied with the care he's receiving at whichever level it is, he should request for a referral.
Okie dokie. It's like we're doing an open clinic here. It's working. Good. Kudos, Nortey and eye specialist. Me, I didn't do anything. What causes tears to flow down one's eye when he or she chews or eats? Hey, how can it be prevented? This is from Yao in Tadi. Yao doesn't tell me what he's chewing though. It could be size 10, Willie, but chewing and tears. Really, Sewa?
As awkward as that sounds,
Okay.
it's actually a problem that occurs.
Seriously?
Okay, yes.
Hey.
And it's because the nerves are supplying glands, and the glands are the ones producing the fluid.
Okay.
So we have nerves that supply the lacrimal gland that produces the tears in the eye, and the nerves that supply the salivary glands that produce saliva. As you chew,
Aha.
you produce more saliva.
Where you are?
Now, sometimes when one of the nerves gets damaged, the body tries to compensate by letting the nerve that's supplying the salivary gland also supply the lacrimal gland. So that when you start chewing, then you start tearing.
From both eyes or one eye? This is incredible.
It's interesting.
Wow.
Yes, it's unbelievable. Okay, so it's a regeneration of the nerves
Okay.
that becomes abnormal.
It's not painful.
It's not painful. Okay, it's not painful.
Okay.
Sometimes with time it corrects. Sometimes you just have to deal with it. That
Live with it.
you just have to live with it, because we cannot go and find the particular point where the nerves
Wow.
are disconnecting and
Okay. Whoa. All right. So if your husband is crying when he's eating your food,
it
you
could
know,
be the pepper.
it could be the pepper or as in, right? We're learning and growing. In the past, when we used to watch black and white TV, we were told not to get close to the TV whilst watching. Is it still the case now that we have flat screens? Oh. My kids like watching their cartoons by getting close to the TV. Is it dangerous, please? In the past, okay, same thing came again, right? And in the past also, when we had eye issues, elders advised that we wash the eye with seawater. Has it got any scientific benefits? I like being on this side, eh? Vera, this sounds like something, washing your eye with seawater and then being up close to TVs and other screens and other things. Is it dangerous?
Okay, so I'll take the last one first.
Okay.
Washing your eyes with seawater is a no-no. So we sit at the eye clinic and we see people come in with really bad red eyes, complicated, because they had a small problem with the eyes. Maybe the eye was itchy, had some discharge, and decided to put in some seawater.
Okay.
So please, it's a no-no.
No,
Now,
no, no.
medicine has advanced. There's treatments for
99.7
everything. If you have an eye problem, just like Sewa said, see an eye care professional. Don't self-medicate.
All right.
And our seawater is not the best.
But it's free.
It's free.
Sandy and salty.
Yes.
You're adding
you're
sand
adding-
and all the comininis and the ojiji krujis.
bacteria and
Ooh,
parasites and so many. I mean,
that's a whole bacterial war in your eye.
Exactly.
Gee.
And you don't want to do that. You
Okay.
should see them when they come to the clinic. It's really bad.
Okay.
They come with very red, angry eyes, purulent discharge.
Oof.
So please.
So the elders who are giving that advice, you are warned. Right. And then sitting close to the TV, kids, cartoons, adults, etc. Is that dangerous, harmful to the eye?
So you see, kids who sit close to the TV, they do that because they can. Okay, so the child's eye has got what we call a very high accommodative power.
Okay.
Okay, so they can come so close to the screen and their muscles in their eyes will contract so nicely. And when they move backwards, the muscles will relax. Okay.
Okay.
But as they grow, that muscle, the accommodative power of the eye reduces. So it's a reason why not at 40 years you have to move your phone far away before you can read.
Are you talking to me?
Because your accommodative power at that age is virtually
I bought
gone.
a phone with a bigger screen. Oh.
So you increase the font size.
Font size, vam.
But when you're reading the insert in the medication, you know, or the Bible, you need to move it backwards because the eye is not able to accommodate
Right.
as well. You as you age, the accommodative power reduces.
Okay.
But for children, when they stand 5 meters away and they stand a meter away, the muscle just relax and contract
Okay.
like that. So they are able to do it. That is
Right.
why they do it.
Okay.
Usually, just leave them. As they grow older and they are not able to do that, they'll start moving
They'll
backwards
adjust
by
themselves.
themselves.
Okay.
Occasionally, some children too who do not see properly will move objects very close to themselves. So if they are reading, the book is very close. That may tell you that the child has a refractive error.
Okay.
But majority of the time, it's just because they are able to do it.
All right. Things are working, eh? Nortey, mine has to do with my family. My old woman, elderly brother, followed by my sister, brother, and all those are using spectacles. Am I safe to be the last born? And moreover, I sit by my laptop for long hours. Douglas from DC. Hey. Right. So far, he hasn't had a problem, but he's seeing the generational whatever. So these things can run in families. I guess that's the thrust of what he's asking.
Yeah.
Right.
So refractive error can run in families.
Oh, they can.
But I'm looking at the way he's describing it. My old woman, my elder brother.
So his
as
mom,
you age,
his
as
older brother,
well,
yeah.
you need, because you remember we spoke about
Abenyiabeto.
cataract.
Right.
That as you're growing,
Okay.
the lens is supposed to relax and contract. The muscles that hold the lens are supposed to do that. But as you
Okay.
age, all that wears down.
All right.
Okay, so sometimes you may need glasses to be able to see well.
Okay.
However, refractive error, the need to wear glasses, can actually run in families.
Okay.
Okay.
Great. Douglas.
And
Say it.
let me just quickly
Yeah,
add, it's not so bad to wear glasses. It actually solves your sight problem.
Yeah,
So
yeah.
you just, it's not something to.
When you get used to it, Charlie, it's funky. You.
Precisely.
The first time I was told I needed glasses, I said, "What? Me?" Then they said, "It's your age, your age." I said, "Hey, be very careful." So I was in denial for a bit until I started. So what kind of frame? I don't want to hear bifocal. I don't want this. I don't want that. The first glasses I had were awful. I looked at myself and said, "Oh my goodness, this one." I get to the lecture hall, the kids will laugh, right? But you get used to it, and then you get funky, and you want the
yeah.
designer
There are
ones.
lots of nice, stylish frames available.
Yeah. Even those who don't need them are
Exactly.
I'm
I'm wearing them.
cat eyes.
okay.
Everything.
Right, great
it's
stuff.
All right
But
to wear glasses.
let me activate the phone line 0302216541. Some say I say too fast. 0302216541. Healthy buttons to push to get in on Ultimate Health on Joy 99.7 FM. Dr. Jifal Fureje, Dr. Vera Bayu, and Dr. Sewa Aqua. They've got the answers. I've got the buttons. So you call and we will do the business. Right. Hey, I want so many text messages. When am I going to get to dry eyes? What's the difference between an optometrist and an ophthalmologist? How safe are eye whiteness? Yes, sir. Is it okay to use them? When you wake up and you can't read clearly, like you normally do, what's wrong with you? You're still asleep. The letters appear blurred and the effect clears slowly in minutes. This is Na Inosu. Right? Take a note of these. I'm just trying to run through quickly. Please, illumination at night whilst watching TV. Some switch off the lights in the hall whilst watching TV. Can it affect the eye? Right? So these gadgets and darkness and the type of light. Good afternoon, Nortey by Nature and the team. Where are you? Right? What causes dryness in the eyes? Oh, Akwaba. We've been trying to get to dryness and the things are just flowing. For 2 months now, my eyes are almost dry. What should I do, please? This is from Nana. It's not water and sewage. Wait, it's not the water company. Vera will answer those in a sec. Please, is it good to watch TV with the lights on? This is from Mate in Adotaiman. Right? Okay, confessions are coming in. I think, hang on a sec. Oops. I think you just described it, but I'm not sure. Those who have eyes that one looks the other way, the other looks the other way, what's the name of the condition? It's called double track. And can they see in both eyes? I never really know which eye is seeing and which one is not seeing. This is from Nine Spintex. Okay, you want to take a stab at some of these quickly?
Okay.
Yeah?
So let me take that very last one. So when your eye is not looking straight, usually we call it strabismus.
Yeah.
Or some people call it a squint as well. So strabismus or a squint. So most of the time, the eye that doesn't look straight is not seen properly. It's
Okay.
the one that is looking straight that sees properly.
Okay.
And if it's in both eyes and both of them have the opportunity to look straight, the vision may be equal in those eyes. And it can be corrected. We can, depending on what's causing it, we can give you glasses or we can do surgery for you.
Okay.
And you look amazing.
Right. Okie dokie. Dryness.
Okay, yes.
Yeah, dryness.
So, on the dryness of the eyes. So when we talk
Does it
about
have a name?
it's called dry eye disease or dry eye syndrome.
Oh, nothing Latin or anything like that.
No.
Oh, boring.
Well, we
Keratoconjunctivitis sica, if you
yes.
should ask.
It's called dry eyes. Okay,
Yes.
simple.
Yes.
Thank God. All right.
And it's a very common disorder. In fact, it's one of the top causes of OPD attendance at an eye health facility.
Okay.
And it simply means that the eye is unable to keep itself well moisturized.
Okay.
Now, the eye, just like the skin, has natural moisturizing abilities. And this is done by the tear film. And the tear film has a sticky part, a watery part, and an oily part. The sticky part helps the tear film to adhere to the eyeball. The watery part is what actually moisturizes the eye.
Okay.
And also has some nutrients and antibodies, so things that fight infections in
Right.
the eye. And the oily part helps the tear film to stay on the eye for a long time.
Okay.
Ideally, the tear film should stay on the eye for about 10 to 15 seconds. And this is because normally our blink rate, that's in a minute, you're expected to blink about 4 times in a minute. So if you divide 60 by 4, that comes to about 15. So that's why we have the 10 to 15 seconds. And every time you blink, a new tear film covers the eyeball. In some people, there's a defect in this mechanism. So
Right.
either they're not producing enough tears, that's in quality and or quantity. So for some people, the quantity is low. For others, they are producing the tears, normal quantity, but the quality is poor. So either they don't, in such people, mostly the oily part of the tears film is deficient.
Okay. Let me
And
just
so-
remind my listeners that the phone lines are active and they'll start screaming when we're gone. 0302-216-541. Lines are active. Abeku, if we have anybody. Right. So
Yes, so
essentially,
the tears
just a bit.
evaporate.
So when you blink,
Yes.
you're actually
You're covering the
covering the
eyeball
eye
with a tear
with
film.
a tear film.
Yes, which keeps the
Right.
eye nicely moisturized.
God is good then.
Yes,
Right.
very good.
Wow.
And that promotes clarity of the cornea, the front clear part of the eye, which
Okay.
helps us to see.
All right.
And so either you're not producing enough tears or your tears are evaporating quicker.
Okay.
And that's probably because the oily part of the tear film is deficient.
Okay.
And so your tears, you blink all right, but then it dries faster than the 10 to 15 seconds that
Okay.
I mentioned earlier.
Right.
It has so many causes. They are varied.
Right.
Aging, chronic diseases. If you have things like allergic conjunctivitis, I mentioned,
Right.
pterygium, as Dr. Foreje, growths on the eye. If your eye is unable to close
99.7
normally, so people who have had stroke and have a facial palsy, so
Right.
they are not able to shut their eyelids well, or they have protruding eyeballs, either from disease or naturally,
Okay.
then it means that your eye will be exposed and your tears will evaporate.
Okay.
People who work with screens for long periods of time, so you work with a computer, and now because of COVID, everything is, well, we're doing a lot of virtual meetings, we're working on our laptops, on our phones. It means that you're going to be staring at your screen for a long time.
Okay, just pause there because I have to blink and go to the phone line. otherwise, the caller will get dry. Sorry. Hello.
Hello,
Hiya. Who am I speaking to?
Elizabeth.
Elizabeth. Hey, how are you? Where are you calling from?
I'm calling from Dansoba.
Dan Soman. Okay, share with us quickly. What's your question?
My brother,
Yeah, your brother.
sometimes his eye one looks at the other side and one looks straight.
Okay. How old is your brother?
What's the problem with him?
Yes, but I'm asking how old is your brother?
He is 8 years.
Okay, and how old are you?
You said
How old are you?
I'm 10 years.
You're 10 years. Okay. And you want to know what's wrong with your brother's eyes, right? Is Daddy the one coaching you with the question?
Yes.
Okay. Daddy, thank you. I'll get an answer for your daughter. Great, eh? 10 years asking for an 8-year-old. Okay. Otherwise, she would have been in trouble for saying his eyes are looking this. But she's concerned. We've explained it,
Yes.
but she's asking what's wrong.
So it's called strabismus. So now it could be that your brother needs to wear glasses.
Okay.
It could be that there's something in his eye, or it could just
So
be
he
that
has-
he was
has to be
born like
examined.
that. So he has to be examined.
Go to hospital.
But rest assured, something can be done about
Okay.
it.
Great. I have another caller. Hello.
Hello.
Yes, hiya. Who am I speaking to?
Yeah, I'm Tony speaking from Sunyani.
Sunyani, great. You're welcome. Share with us.
Thank you, my brother. Thanks so much for this educative program. I have a problem when it is in the evening, when the sun is about setting. I see objects very blurred.
Okay.
Right. That has been my problem, yes, sir.
Right. How old are you?
I'm 58.
58. And how long
Yes,
has this
please.
been the case? How long has it been?
Just about 4 months down the line, but I'm using these glasses. I'm short-sighted,
Okay.
so I'm using glasses.
All right.
Yes, sir.
Okay. Right. Let me get an answer for you. So when it's getting dark, he has. Yep.
So with his age, it could either just be cataracts happening,
Okay.
and he just needs to get it checked. He might need to change his glasses. And as we grow older with the weakening of our eyes, sometimes you need more light naturally to
Okay.
see things.
All right.
So like anything else, we cannot diagnose over the radio.
Okay.
He needs to walk into a center and get
Right.
his
He
eye
knows he's
checked.
short-sighted, so maybe he has contact with a facility or one of the
Precisely, that he can actually get it checked.
professionals. All right.
Yeah.
So have that checked, and then if there's anything, send us a message, and we'll see how we can patch you through or get some assistance. I have so many calls. Hello.
Hello, good afternoon.
Afternoon. Who am I speaking to?
Please, I'm Nana.
Nana, where are you calling from?
Please, don't look at me.
Domi Kwabenya. All right. Share with us quickly. 3 seconds.
Okay. After pterygium surgery has been done, I learned it might come back 1 year after. How true is it? And is it advisable to get glasses? And another question. I learned macular scar on the macula, nothing can be done. But is it advisable to get maybe what to do or any food that you can prevent yourself from? Thank you very much.
Okie dokie. So when the pterygium is removed, will it recur?
So if there are different ways to remove a pterygium, okay, the easiest, fastest, obsolete way to do it is just remove the pterygium and do nothing about it. And if
Okay.
we do that, there's a 98% chance of it coming back.
Okay.
And it could come back within 6 weeks, it could come back within 2 years. We can't determine that for
Right.
sure. If you go to a good facility, we actually have ways in which we remove the pterygium and then we prevent its recurrence. We can reduce the recurrence to about 12%.
Okay.
But that depends on the method in which it's used to remove it.
Okay. Right.
But pterygia can recur.
It can come back again. Right. Abeku says I have another call. Last call. Hello.
Good afternoon, Mr. Alfred.
Yes. Who's this?
Douglas.
Douglas, as soon as you got to know my English name, you are not sparing me, crap. I thought we'd solved your problem. You mentioned that your family has, from your mom to your older brother and so on.
Yeah, but I have another question.
Quickly, please.
What best color do we have for eyes? You know, there are some people you could look into their eyes. They have pure eyes, which is white before the black. And some people could be yellowish in color. And moreover, someone also says using glucose, water, taking it always clears the eyes. How true is that? Thank you.
All right. What color should your eyes be? Should they be white? Should they be yellow, pale? Is there a color?
So normally when children are born, they come with clear white eyes.
Okay.
But as you age, because of
And lose your innocence.
and lose your innocence and see things you're not supposed to see, but that's just by
You see, I
by
got
the
I got
way.
Vera to confess.
Yes, as we age, the color changes from white to off-white, and then in some cases they may have this brownish tinge.
Okay.
Yes,
It's not a problem?
it's not a problem. But
Okay.
if it's yellow, that's is a jaundice.
Jaundice, okay.
So that's is a sign of a medical problem.
Right.
It needs to be checked out.
Okay. All right. So we've done that. This one says the pituitary gland has enlarged. He had a test and it's covering his eye nerves. Can it be corrected?
She needs to see the doctor. She needs to see the surgeons, okay?
Okay.
So usually when the pituitary gland grows bigger, it can affect the optic nerve.
Okay.
She has to see the physician. I'm wondering who asked her to do that test. So
Okay.
whoever asked her to do that test, she
Was
needs to
already
go
looking
back
for
quickly.
something. Okay.
Yes, because when it sits on the optic nerve for a while, it may be difficult to restore the vision in that eye.
Okay, great. We're going to do a blitz. Pus on the eye, frequent pus. Can it be prevented?
So frequent pus on the eye, it could be one of the signs of, it could be dry eyes, it could be recurrent infection, conjunctivitis or
Okay.
infection of the eye.
All right.
It could be what we call blepharitis, a recurrent infection of the eyelashes or eyelid margins.
Okay.
And so it needs to be treated.
You give me about 4 more programs we need to do. Right. Doctor, I'm experiencing something like my eyeball is swelling and I need a lot of light to read, especially in the night, and my brain is giving problems. I know somebody who has a thyroid condition. Now the eye is bulging and looking, misaligned in a way, right? Could this be something like that?
It could be, but once your eyes are getting swollen, it's really a huge red flag. You always have to get your eye checked. It could be from the eye, it could be from the thyroid, it could be from your kidney. It is a problem. So
All
get your
right.
eyes checked.
Do the 3 ophthalmology ladies work in the same place, and where can we find them? They are all mine. You can't, right? They're in Kolebu, right? All of them are in Kolebu Teaching Hospital. So Dr. Aqua, Dr. Fourieje, and Dr. Bayu are all there, right? So if it's about eyes, you can see them. If it's something else, Speak to my producer. We'll take a percentage and then we can talk. Right, we're out of time. Let me just try and read all these quickly. Sometimes you feel pain in the eye as you put on the glasses. It gets a bit relieved when you take them off. At times the reverse happens. Is this a normal?
Yes, some people have spectacle intolerance, especially when they are prescribed glasses for the first time.
Okay.
Either because maybe the power they've been given is too high for them to tolerate. So they should go back and see their optometrist or ophthalmologist, and then that can be solved.
All right, we've gone past 3 o'clock. Can you imagine? This is the day in Maryland, itchy eyes and tears flowing down your cheeks when it's very windy. Is it the same reason for the one where, with chewing?
No.
Nope.
It's unfortunate we were not able to talk about dry eye, but these are some
We'll
signs
do it.
of
We'll
dry
do it.
eye.
We'll do it another
Dry-
time.
Yes,
All
you
right.
need to, because it's very common.
Yeah,
and
yeah,
it's very
yeah.
problematic
But
for
we'll
lots
start
of
charging the people for,
Yes,
the,
we
for the
should.
answers. You know what I'm saying? Yeah. It's been great. It's been awesome. It's been phenomenal. The eye ladies, You see you. Dr. Sewa Aqua, Dr. Jifa Ofureje, and Dr. Vera Beyo, we thank you immensely. We'll see if we can couch another program. If it's next week, it will be great. If not, we'll see how we can pull you back so you can educate. We can see clearly there's a demand out there. So
There was a question about ophthalmologists and optometrists.
Yeah.
Ophthalmologists are medical doctors who are further subspecialized to do the eye.
Yeah.
So after medical school, you go to you do a residency in ophthalmology. Optometrists are
do the-
doctors who are who learn about the optical system.
Right.
Okay, so they are not medical doctors, and the ophthalmologists are medical doctors. Ophthalmologists treat the eye medically and surgically.
Okay, great, right? The difference is clear. 99.7. Many thanks, ladies. Many thanks to Abeku, my producer, and of course, my discerning listeners. It's been amazing, and it has to end at a point, unfortunately. So I'm out of here. We'll be back next week with another well-packaged, nutritious, easy to digest edition of Ultimate Health on Joy 99.7 FM. Stick and stay. Up next is Sunday Rhythms with Bile. Don't go nowhere.